It was indeed a glorious and memorable event at the first Lagos State Health Insurance Summit with the official launch of the Ilera Eco virtual booth, proudly organized by the Lagos State Health Management Agency, Lashma. The historic event was indeed a great testimony to the tremendous, resilient, innovative and proactive efforts of the Babajide Sanwo-Olu-led government to provide quality health care for Lagosians and those in diaspora. For the Lagos State Health Management Agency, Lashma, under the able, dynamic leadership of the Permanent Secretary, Dr. Emanuela Zamba, it was a summit that brought under one roof various key stakeholders in the health delivery chain to prefer solutions and strategies to change the narrative for a greater Lagos through qualitative healthcare delivery.
I extend a warm and heartfelt welcome to each one of you to the maiden edition of the Lagos State Health Insurance Summit, tagged Accelerating Social Health Insurance Coverage in Lagos State, Domesticating the National Health Insurance Authority Act. This summit will serve as a critical platform for exchanging ideas, forging partnerships, and fostering innovation towards achieving universal health coverage in Lagos State. I am delighted to see the health insurance industry's finest minds and important stakeholders gathered here today to deliberate on crucial topics that shape the landscape of healthcare accessibility and affordability. The COVID-19 pandemic exposed vulnerabilities in healthcare infrastructures and the pressing need for robust health insurance schemes. However, it has also taught us the power of resilience, adaptability, and collective action. It is in this spirit that we gather here today to forge a path towards the more secure and healthier future for all residents of Lagos State. In this summit, we will delve into a myriad of pertinent topics ranging from implementing an inclusive, resilient, and sustainable UHC, barriers and drivers of healthcare delivery, and engendering trust in mandatory social health insurance. We will also explore strategies that will leverage partnerships to drive the uptake of health insurance in Lagos State. Let us seize this opportunity presented to us today to engage in critical dialogues, learn from one another, and identify actionable solutions that can drive positive change in our health insurance ecosystem. The Lagos State Health Management Agency over the past 3 years has tirelessly and intentionally worked on creating enduring structures, operationalizing the social health plan's implementation, exploring innovative strategies and initiatives in advancing the cause of UHC. Concerted efforts have also been made to increase coverage while leveraging on technology and partnerships, which we thankfully enjoy a preponderance of. Certainly, we wouldn't have made these strides and come this far without the support of the state's #1 UHC champion, Mr. Babajide Sanwo-Olu, for which we sincerely thank and appreciate him. As we ponder upon the challenges ahead, we must also recognize the tremendous potential this sector holds. By leveraging technology, data-driven insights, and innovation, we can reshape the future of healthcare in Lagos State. Will have far-reaching implications for countless lives, making it incumbent upon us to approach our discussions with open minds. Before concluding, it is important to emphasize that the implementation of a social health insurance program neither stifles nor represses the private health insurance space, as they both complement each other. In the spirit of universal health coverage, by catering to different segments of the population. Succinctly put, we are allies working towards a common purpose, providing accessible, efficient, and high-quality healthcare to all residents of our dear state. Together, we can create a healthcare system that leaves no one behind and reflects the compassion and strength of our great nation. I extend my deepest gratitude to the organizing committee, sponsors, speakers, and participants for their unwavering dedication and support in making this event a reality. Your collective efforts have brought together a diverse range of perspectives, ensuring a comprehensive and enriching experience for all. As we embark on this groundbreaking and visionary expedition, let us remember that the success of this summit rests on the active participation and collaboration of each and every one of you. Together, we can shape a brighter future for healthcare, where financial barriers are dismantled and the benefits of comprehensive health coverage reach every doorstep. Once again, I extend a wholehearted welcome to you. May this summit be a resounding success, marking the beginning of a new era in health insurance, where the dividends of our collective efforts uplift the health and well-being of our great state. Ilera Eko, leaving no one behind. Ilega Eko, Ajimo. Thank you very much for listening.
Let me start by congratulating the board and management of the Lagos State Health Management Agency for conceiving and putting together the Lagos State Health Insurance Summit, the very first at the sub-national level in the country. At the inception of this administration, we made a commitment to improve the quality of life of our people and steer the state towards universal health coverage, where Lagosians will have access to the health services they need when and where they need them, without financial hardship. These services include a full range of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. This is one of the major goals of the health and environment pillar of the Themes Plus agenda, with the plus representing the incorporation of an intensified focus on social inclusion, gender equality, and youth development in these next 4 years. To bring this promise to reality, we wrote on the existing LSHS law, which makes it mandatory for all residents of Lagos State to possess a health plan in order to have access to quality healthcare services, thereby reducing out-of-pocket expenses on health and ameliorating financial hardship caused by payment of huge medical bills. This mandatory provision of the LSHS law was further reinforced when the federal government enacted the National Health Insurance Authority Act in May 2022 and provided for the establishment and implementation of mandatory social health insurance schemes in all the states in order to steer the country towards the attainment of universal health coverage. The domestication of the Act in Lagos State will enable the government to guarantee the provision of basic healthcare services to the citizens, thereby improving their quality of life. I am aware that since its establishment, Lashma has been committed to ensuring that all residents of the state are registered on the scheme, which was rebranded in 2021 as Ilera Eko. Every resident of Lagos State should have access to quality care, especially small business owners, the informal sector, and vulnerable persons. In order to support these efforts of the agency, we registered all our employees in the state civil service on the scheme and subsidized their premium, whereby government remits 75% of the premium and the staff pays 25% annually. Recently, we have included additional benefits on the Ilera Eko health package for public servants. We have also heeded to the concerns of public servants living in the outskirts of Lagos State by establishing the trans-border care for public servants on Ilera Eko through the partnership between Lashma and Ogun State Health Insurance Agency. I think a lot of us are aware. I think that is something that is really worth acknowledging. Because of the cost of living in Lagos, we have a lot of people who work in Lagos but live on the outskirts and in Ogun State. And it's important, I mean, we saw with all the things that were showing, it said, leaving no one behind. Leaving no one behind. And so we're making sure we don't leave even the people who live in the border areas behind in providing services. We have also created an Ilera Eko diaspora plan to enable people living outside the country to buy health insurance plans for their families. We are committed to ensuring that all other residents of the state are not left behind and are duly enrolled on the Ilera Eko health plan. To this end, I have issued an executive order for the commencement of the domestication of the NHIA Act and the implementation of the LSHS. This will make it possible for the agency to engage with all key stakeholders and ensure that residents of Lagos State have access to quality and affordable healthcare services, thereby moving the state closer to the attainment of universal health coverage. In recognition of the fact that a sizable proportion of residents of the state may not be able to afford the health plans, we have committed a minimum of 1% of the consolidated revenue fund as equity fund to the Lagos State Health Fund to provide coverage for vulnerable groups by purchasing Oyedepo plans. The equity fund has been approved as a first-line charge for coverage on Oyedepo. To complement this, we have also established a social health alliance, a COSHA, as an alternative financing mechanism for increased access to health, social welfare, and empowerment among vulnerable residents in line with our commitment to the principle of inclusivity and social protection.
It gives me great pleasure to join everyone at the maiden edition of the Lagos State Health Insurance Summit, an initiative of the state government through the Lagos State Health Management Agency, Lashma. This summit is designed for critical stakeholders to brainstorm and collectively articulate ideas towards improving health service delivery, particularly the health insurance scheme, in line with the National Health Insurance Authority Act for the benefit of all the residents in the state. As you are all aware, the present administration of Governor Babajide Olusola Sanwo-Olu is passionate about the health and well-being of residents of Lagos, as health and environment is a key component of the Themes Plus developmental agenda for the state. The state government, through the health insurance scheme, is strategic towards providing affordable, comprehensive, and unhindered quality healthcare services for all residents, ensuring financial protection and reducing exorbitant expenditures. It is pertinent to stress that this administration has put measures in place to revamp, rejuvenate, and to reposition the sector for effective and efficient service delivery. As a medical professional and an advocate for quality healthcare service delivery, I am convinced that this forum will further spur various ideas and strategies poised at providing residents with access to needed health services, including prevention, promotion, treatment, and rehabilitation of sufficient quality, and ensuring the users are not exposed to financial hardship. To this end, I'd like to applaud the Lagos State Health Management Agency, Lashma, for their continuous efforts and commitment in promoting, regulating, and supervising proper administration of the health insurance scheme, most especially in coming up with this laudable program that serves as a veritable platform to discuss and dissect issues relating to health management and provide lasting solutions to its challenges. You will agree with me with this forum that it is a win-win for all. I therefore seek the cooperation and the collaboration of all stakeholders to support the government in its quest to improve the health sector. I wish you all fruitful deliberation, and I thank you for your attention. Thank you very much.
Along with other countries, Nigeria has been committed for a while to achieving universal health coverage. And I recall that it was, I think, the first national platform where there was a commitment from the national through to all the states and LGA was in 2014, where there was a presidential summit on universal health coverage. And we moved on to the National Health Act, and the journey has continued since then. But way before even that presidential summit, we had the enactment of the National Health Insurance Scheme Act in 2004. And the scheme became operational in 2005 under the leadership of former President Olusegun Obasanjo. Now, with years of implementation, we realized that there was the need to further evolve in that commitment of using NHIS as the vehicle. For the first decade and more, implementation of the drive towards universal health coverage was primarily driven by NHIS, with some work being done by the HMOs, not just for NHIS, but on the private sector to enroll them into one form of health insurance or the other. In 2015, the National Council on Health recognized the need to decentralize this work towards getting Nigerians to have some form of financial protection to ensure that people can access care when they need it without having to pay out of pocket or without the risk of being impoverished by the healthcare expenditure. So the National Council on Health made the decision to allow and encourage states to actually set up state health insurance schemes, programs, or whatever name it goes by. And guess the first state in Nigeria after that happened to sign a state health insurance law? Lagos State, same 2015. So it's not by accident that we're here attending and participating in the first state health insurance summit again in Lagos State. And then there was the National Health Act. The National Health Act introduced something which has also been quite supportive of the health insurance schemes at the national and subnational level. The Basic Healthcare Provision Fund, which again, distinguished Senator Lanre Joshua. The Basic Healthcare Provision Fund is established by the National Health Act of 2014, which says that the federal government would commit at least 1% of its consolidated revenue fund, CRF, to a pool to finance health that is shared to health insurance and some to the supply side to ensure that personnel are trained, commodities are procured and all that. And for the first 2-3 years, there was basically no funds, even though the act was there. Now, moving forward, the NHIS Act of 2004 made health insurance voluntary for Nigerians. And we recognize that where you have voluntary health insurance, it's likely that a lot of people will opt out and there is nothing you can do about it. And beyond people opting out and there is nothing you can do about it is also the issue that government does not really worry about making sure everybody is covered, because after all it's not mandatory. The people don't have to opt in, government doesn't have to do beyond whatever they feel like doing. After a lot of iteration, the National Health Insurance Authority Act was enacted. So NHIA Act moved us from a law that says health insurance is voluntary to a law that makes health insurance mandatory. The second one is NHIS have been trying to decentralize to be able to better support states and also oversight HMOs by open zonal and regional offices. But this was not in any way recognized by law. So any executive secretary of the NHIS who felt otherwise could actually come and just scrap those offices. But now the law actually recognizes the establishment of NHIA zonal offices. The third one is because this NHIA Act now recognizes the Basic Healthcare Provision Fund and expands that from not just the 1% of CRF, but to a vulnerable persons fund that can draw money from other sources.
The historic event was also a veritable platform that effectively encapsulated the mission of Lashma through the Ilera Eko mantra, which simply says, leaving no one behind. The most revealing and thought-provoking aspect of the summit was the fundamental and critical issues raised during the panel discussion by various health experts and stakeholders.
So Lashma is already working with different companies, just like the government, which is going to be using telemedicine. And there are many other initiatives like that. Telemedicine is great because what it will do is that it will help decongest the hospital. So only the cases where persons need to get to an actual hospital or clinic, they need to go there. So it will help decongest that. So that's one. The other aspect of this is electronic medical record. That's also very important. So, and this electronic medical record needs to be integrated in a way that would allow people that have seen a doctor through telemedicine to also be able to continue that healthcare in the hospital without anything being, without any loss of data. So that it would look as if it was the same hospital that they spoke to. And technology can do this very efficiently without issues. I think the third thing that is also very important is data, gathering data. Lashma cannot succeed in doing this efficiently without a lot of data. And that data will be data that is giving information about the quality of care that are disseminated in different healthcare facilities in Lagos. What's the satisfaction ratio of patients? Is it getting better? Is it getting worse? What is working and what is not working? And this data can be collected through different means. Technology can help a lot. And the data needs to be aggregated and be consumed in a way that it will help honestly. That I think is very important. Some of this data can be brought in, there are a lot of metrics that can be tracked. How long does it do people wait before they see a doctor, for instance? How long does it take before you get an appointment with a doctor? Things like that. So those data can help actually track which area needs more improvement, need a virtual code, for instance, and things like that. So those can help them. Deploying artificial intelligence or some form of automation can also help as well. So there are trial systems that exist in different places, even outside Nigeria. And those technology exists, we can adopt them and use them. That can help to triage or prevent even having somebody to have to go into a hospital in the first place. And help with bookings, managing bookings and appointments and things like that. So those are some of the things that can be done as well. I think for this to be effective, technology, they will help you to be able to learn.
I think to a large extent, healthcare facilities are prepared for this task. If we can recollect, we know that presently, all healthcare facilities that are legal, that are registered with the various council, whether MPCN, whether Pharmacy Council, whether the Council of the Physiotherapists or the Medical Lab Scientists Council, they are all registered. The personnel there are registered to provide services. The other leg of registration or licensing is their premises or facilities. We also have agencies responsible for that. Here in Lagos, we have a FEMA that oversee, that monitor, and accredit health facilities in Lagos State. So if you are practicing legally, you must have been accredited or monitored by a FEMA. But the second thing is about information dissemination. It's very key, and I've heard that said again and again here today, that we have to create awareness. Awareness not only in the public space alone, but even among providers and among facilities. When we provide, when we are aware, when information has been disseminated that we are coming from the era of NHIS where health insurance is optional, so the time that it is now mandatory. We have to, as providers, as facilities, go out there, because governments alone can't do it. We have to go out there and tell people. The people practicing in the various communities, we are more or less the first point of contact that patients come to. So we have to educate them. There's no practitioner that will say a week will go without you having a patient coming in to say, I can't afford what you are prescribing for me, or what diagnosis, or what lab test I need to carry out. So that way we can engage them one-on-one, we can engage them in groups. Like Dr. Boyo said, there must be a kind of community engagement to do that.
40% of patients still come to the secondary healthcare or the government public healthcare facilities for their care. So it's not like we don't have patients coming. And over the last few years, there has been deliberate effort to try and improve the quality and the services that are offered in secondary healthcare facilities. We started with this hospital transformation and support initiative, where we started to look at how we run the secondary healthcare facilities. And we talked about sustainability. So that means you have to talk about developing the system, and you have to develop, you have to create a pattern by which these things can be sustained. So we looked at it from in terms of leadership. How is the leadership of secondary healthcare facilities determined? What level of strength do they have? So for the employment in the leadership, the way that was done was different from the way it was done before. We went through a series of levels of interviews, what we call the assessment center, to get people for training, to get people to be appointed as medical directors. And these medical directors now have orientation before they can, take up the job, and they go through a series of training.
We start without the expected policy aspect of it. And a whole lot of the presenters earlier, speakers earlier, had actually mentioned the very key critical role that distinguished Senator Oyedepo should play. As we strive towards this UHC job, now that we have the revised Act, now the NHIA Act, which played a very humongous role in actualizing, there were stated expectations in terms of what the narrative needed to change for the country as a whole. It would be good that you share with us and helping guide Lagos State as it continues their journey. Those key lessons, as well as the very slippery banana pills that you actually want us to avoid as we go on this journey. Senator Tejuju.
Thank you. Good afternoon once again. I just want to ask the audience one question. How many of us have visited a primary health center this year? The primary health center in Lagos State for a medical service, not for inspection, for medical service. So the domestication starts from you, because all the noise you have been making on this while about putting money into health sector is 80% to revive our primary health centers. And we are now saying it is now compulsory for every Nigerian to contribute towards the health insurance. We need to make the people have some confidence in our primary health centers, to make them pay happily, that when they contribute, they can go to our primary health centers and have a service. And it's people like you that can help the government to complain about the situation we find in these primary health centers. When you have a headache, you either go to teaching hospitals or you go to secondary hospitals, which is a misnomer. We are complaining about funding. National Health Insurance Act, Insurance Authority Act now has made it compulsory for every Nigerian to contribute. So after we get all this money, we need the state government now to make the primary health centers inviting for all their patients. So that is the first aspect that is very important for us to ensure that this domestication is going to work. Secondly, we cannot talk about the National Health Insurance Authority Act without talking about the 2014 Health Act. Because the 2014 Health Act also says that the federal government of Nigeria compulsorily will put in 1% of the consolidated revenue fund into a basket for this same health. And 1% 4 years ago was around 55 billion, which is now a statutory contribution, is every year mandatory for the federal government. So you can imagine that kind of money available, and even 80% of that is supposed to be spent in the primary health centers.
The first Lagos State Health Insurance Summit, proudly put together by Lashma, is indeed a landmark event that established one fact, that Lagosians are in for a good deal in the area of healthcare delivery under the administration of the Babajide Sanwo-Olu-led state government. For the permanent secretary of Lashma, Dr. Emanuela Zamba, she gave these assuring words to Lagosians.
We know that it's a very tall order, and we're not looking at it as if it's something that's going to be extremely easy. However, we've spent quite a few years trying to establish some level of structure and build so that when we do have the eventual scale-up, we are able to absorb and continue growing. Some of the things that we're doing have already been said through speeches, etc. Or maybe I should just highlight a few things. I talk about governance, for instance. The way Lashma is run is that we have 3 independent structures within that agency that have different roles. So the first arm of Lashma, which is Oyedepo, is like the public HMO. We now have the regulatory arm of Lashma, which is looking at regulatory issues. And then the last arm is to do with vulnerable coverage, which is the Social Health Alliance. And they are responsible for resource mobilization to help with sustainability of enrolling vulnerable people. As was said in Mr. Governor's speech, we have an executive order. And some of the things in that executive order will help us to propel health insurance forward in Lagos State. And I also speak to maybe public awareness, which is it's capital intensive, and it must be sustained to make any difference, because getting people to be aware and even influence their behavioral change is a medium-term to long-term investment at best. And I was very happy to hear in Mr. Governor's speech that he has pledged to provide funding for us to be able to do that. So that is something that we would adopt a multifaceted approach. As we said, our target is more of the informal sector, MSMEs, and vulnerable people. So we will have a plethora of channels to be able to engage those people. Stakeholder engagement is very key. One of the reasons why we're here today. And we'll be having that as a sustained rollout, meeting with various stakeholders across the health insurance ecosystem to see how we can move forward. Deepening access by leveraging on technology. If we say something is mandatory, then we are duty bound to provide access to people. There are still areas in Lagos that do not have facilities, and there's a dearth of facilities. So we are hoping that the Eco virtual booth that we launched today would fill in a gap and help in that regard. Vulnerable coverage is a very big issue. I've already mentioned the Social Health Alliance, and as Mr. Governor said, he has pledged to equity fund coming out on a first line charge. The interesting thing about the Social Health Alliance is that we have a sustainability component built into it. When you make the funds, you can't keep keeping the same people on the scheme ad infinitum. You have to have some level of an empowerment program attached to that, so that over a period of maybe 2 years, those people get empowered and they now transit. So we have an exit plan. For about 2 years, we now transit into a paying enrollee, albeit under the Oyedepo Christmas Fund. I see that I'm being, all right, I think I'll stop there. Thank you.